that we can ensure that our officers deliver.
Now, the world today, May 5th, marks International Day of the Midwife, with a focus on how midwives and women can partner together to mobilize and unite toward a shared goal of gender equality. But for Kenya, this looks like a forgotten group, with a membership of a 3-year-old Midwives Association of Kenya standing at a paltry 250 nationally. Now, Kevin Ogutu has more from Kisumu. Kevin Ogutu, very good morning to you. Even as we recognize the International Day of the Midwife, their role is definitely quite fundamental. Bring us up to speed with the latest.
Well, the world is marking the International Day for the Midwife in the wake of the coronavirus pandemic. Remember, this is one fraction of medical health practitioners, those who are contributing to the well-being, especially in matters maternal and child health. But this has come at a time when we've got this serious complication. So basically, we have got a difference between a traditional birth attendant, who are largely untrained, but who would ordinarily help women in giving birth, especially in rural setups. But talking about a midwife, this is a trained person that's supposed to aid in matters childbirth for the safety and the good health of the newborn and also the mother. This is somebody who is well trained. So as you mentioned there, we have got a paltry 250 members of the Midwives Association of Kenya, MAK. This is a really slow number if you have to divide that by 47 counties. But this is something better than what we had about 6 years ago, because in 2014, the country realized, and medical practitioners realized, that we had just about 71 membership, and yet this is quite a very big contributor towards the health of the newborns and also the mother. So this is one discussion that you want to carry forward. I have with me here Esther Okech from the Kenya Female Advisory Organization, and we'll be speaking on basically what this means, having such low numbers of registered medical midwives rather, and what kind of complications this coronavirus pandemic has caused when it comes to issues of maternal health. The Kenya Female Advisory Organization, to a very large extent, deals with matters maternal health, women empowerment, and every other thing in between. And we will be having a candid discussion here with Esther. Esther, welcome to KTN News Center. You've been at the forefront, but here are the numbers. We are celebrating International Day for the Midwife. Take us through the kind of picture that we have, you as a serious stakeholder in matters maternal health. Why does it look like this is a neglected group?
One of the things that we need to talk about is that we look at the data which has been shared within the counties and within the counties on matters of maternal and neonatal deaths and infant mortality. So part of it is that we must be very conscious that there's been progress made from the previous years, but the challenges which we are currently facing within the COVID period is that we might have a clawback with those progress which has been made in terms of the quality of services which are offered within the maternal, neonatal, child and adolescent health sector. So part of it is that what we are looking at is that it's a very important cadre to have within the health facilities, because they're a critical part of those health workers who must be within the health facility when a mother is giving birth. So if we have reduced numbers who are supposed to be qualified to help a mother give birth holistically, then we have challenges. So when we reduce numbers, then we find that in certain spaces, particularly within rural communities, such important persons who are not in those cadres within the health facilities and are left out means that we are having more challenges, and that is why sometimes you even have children who are born with more complications, yet this one can help a mother be able to give birth. So part of it is that we are also urging the county and national government to look at the cadres. When you look at the cadre of health workers, midwives are a very important cadre in the health worker sector. But if you're not having them within that sector, then we have a challenge. And we are also then seeing more challenges with mothers having a state where you cannot help yourself, you cannot go to a health facility, and when you go to a health facility, the holistic care which you need is not available readily.
Well, Esther, we're talking about a cadre that apparently we are not paying a lot of attention to, but I would like to take you back a bit. We had the community health, registered health nurses. These were particular segments that were picked from the public health, the nursing, and also the midwifery. And then they were supposed to be a one-stop shop and all-round individuals who are supposed to help when it comes to all other parts of public health, midwifery, and also nursing. But apparently this is appearing not to be the case, talking about the kind of passion that one needs to be a proper midwife. Let's talk about the character of a midwife. This is somebody who has dedicated their time towards this cause. Are we comfortable that, given that the nurses have been trained at midwives, they will be better off than those who are purely interested in midwifery?
I think we'll go back to the bit of where you're saying they were core to part of what primary health care was. In terms of primary health care, those are the kind of persons who then you would find at community systems. So within the community systems, even you're talking about the community registered nurses, they would be found at that community system. So part of the process is that within our own health system, are we investing enough in primary health care so that we can have those cadres who can help mothers before, prenatal and at antenatal times? So if we are looking more at the curative level, then that is why we are not investing in that particular cadre. And that is why we are also not ensuring that these community registered nurses, who should be at the lowest level, at the dispensaries where you can also get information, where you can also get issues, and someone can walk with you the journey. That is what is important. So part of it is that we have to look at our investment in primary health care vis-a-vis curative. So curative finds you in the health facility. Yet, in this other space, you are able to then ensure that you have a journey. You walk with such kind of cadres, you have a journey in which you walk with. So part of it is that we must look at how the country is looking at primary health care and which cadres of health workers must be invested in. So if you're looking at the slow increase in the cadres and the vis-a-vis the numbers of women giving birth in health facilities, plus adolescents giving birth in these health facilities, then we still have a long way to go.
Well,
that is important for us.
Well, there's also a concern here, Esther, about the COVID-19 and people shying away from hospitals because of the fear that they could get infected with the virus. I don't know whether this has come to your attention, and what does this mean for our mothers, especially the young mothers who find themselves pregnant and then they have now to give birth in probably unsafe conditions?
People fear because, one, there's the issue of quarantine. And then there's the issue of people being told test. So a number of mothers are fearing to go because, one, if you don't have masks, for example, there are poor women and adolescents who cannot afford the mask. We have had stories, and they're not just stories, of people sharing masks because you can't afford. So you share the mask so that when you're going to a public space, then you share. So part of it is that is part of what public health information is supposed to be, that we should not fear. But if information is not going to communities about that you'll not be forced, then that is the reason why people are afraid to go to the health facilities. And one of the challenges within the COVID-19 process is the curfew. Birth is not programmed that you'll only give birth between 5 o'clock to 6:59. So part of the process is that at night in rural areas, in islands where people are, where do you get spaces where health workers will be working, and we've had challenges of health workers also being arrested. So part of it is that when the health system is not strengthened enough to be able to help these women get to the health facilities, women are actually giving birth at home. And we don't have just a single case. Even in Kisumu, we've had cases in Homa Bay, we've had cases in Siaya, of women giving birth at home because of the challenges faced during this emergency period. If you can't get a letter, for example, from the health facility, and we've had cases where even someone takes you to the hospital, the person is assaulted. So the police must also be well versed that for the health system to work, they must know that reproductive health must be protected.
Well, thank you very much, Esther. Because of time, that's a discussion that clearly we needed a lot of time to exhaust it, but because of the time, I'm informed that we now have to end it there. Very pertinent issues coming up as the world marks International Day for the Midwife. The issues of COVID-19, the curfew, and the health challenges that have been forced, that have been posed by this current situation. Easter, okay, breaking down for us this, and of course a challenge on the budgeting, why we need to really invest more in this particular cadre of healthcare providers.